This is Urban Health Today. I'm Tamara Thomas, editor-in-chief of Urban Health Today, and I'm speaking with Gaylyn, an IBD and ostomy advocate living with Crohn's disease. She's here to talk about the importance of representation and normalization of ostomy bags, particularly in the Black community where IBD diagnosis is on the rise. Thank you for speaking with me today, Gaylyn.
Thank you for having me.
It's great to have you. All right, let's begin. So you were only 14 years old when you were diagnosed with Crohn's disease. How did that early diagnosis shape your adolescence and personal identity?
Yeah, absolutely. So I was 14, as you mentioned, when I was diagnosed at a time that your body, anyone's body is changing physically, socially, biologically, So I was diagnosed at a critical time in my life, I feel. I often hear people say that my diagnosis doesn't define me, but I would argue that my diagnosis absolutely defines me. It helped shape me and it helped mold me into the person that I am today. I was diagnosed with severe Crohn's colitis, Crohn's disease primarily in the colon. And at the time of my diagnosis, unlike other people or many other people of color that have received a Crohn's diagnosis, I was diagnosed rather promptly because of the severity of my disease. And
Oh,
yes, almost immediately. And I do feel looking back um, that my disease was so severe, probably due to cultural factors, including dismissing the fact that, that I was feeling unwell or that, trying to blame it on something else or blame it on nervousness, blame it on, I was starting high school. So, nervous about starting high school. I had just gotten braces, we blamed it on braces. Really almost being in denial about the situation. And I feel that that is something that many, Black families may understand and may identify with, really trying to sweep illness under the rug. Um, but there came a time that, it was absolutely no way to ignore that fact that something was wrong. And like I said, I was diagnosed with a severe case of Crohn's disease, survived stricturing, narrowing of the intestines, um, stricturing, fistulizing disease where organs connect to each other due to the
mhm.
severity of the condition. So yeah, so I feel that it has molded me because of my journey, because of my experiences, I feel that I have an innate responsibility or desire to help people. It has guided me to my career in public health, and as an advocate to, improve other people that are in similar situations living with disease, as well as empowering those that feel that they don't have a voice or that are misunderstood or misrepresented in society. So.
So just to from my understanding, you were diagnosed quickly when you finally did see a doctor, but your family, was it your family that was sort of in denial, like, oh, it's just stress, oh, it's just growing up, oh, it's just your braces.
I
Was
feel
that-
that was in the beginning, like leading up to the diagnosis. Like, so I was diagnosed when I was 14. I would say that symptoms began when I was, well, noticeable symptoms that something was going on when I was 13, increased bathroom visits, weight loss became a symptom that, extreme weight loss. And when you first get braces, they say, you can't eat, that may happen. So, we were trying to blame it on these types of things.
Mhm.
And then I started seeing blood. And so, at that point, myself and my family, we were like, okay, there's no more, we can't blame it on anything else. We need to figure out what's going on. So I think it wasn't denial once I was diagnosed,
Mhm.
but um like leading up to the diagnosis and trying to like hoping, or maybe it was hoping that something else was going on, and
Mhm.
that it wasn't something serious. Um and I also feel that I was brought up in a religious household, and I feel, that's something that also played a factor, you
Mhm.
know, not speaking it into existence.
Ah, yeah.
The tongue is powerful. So I think that's something to this day that has impacted my disease journeys profoundly. So yeah, so there's a lot of cultural factors that I feel that played into my diagnosis, leading up to my diagnosis, my disease journey, and even to today.
So how did your family initially respond and your community to your diagnosis, and what helped you navigate that support system?
So, initially we thought we take the medicine, everything will be okay. So I think nobody can really prepare you for inflammatory bowel disease, Crohn's disease, and definitely the severity at which my condition was. So, and my physicians at the time, they weren't that forthcoming, I would say. They didn't really share, how this was going to gravely impact our lives. So,
Mm,
we thought if I take the medicine, we'll be okay. And then it wasn't until like, taking medicines and everything wasn't okay. Like our lives were turned really upside down. I was in and out of the hospital, had severe complications of the disease. But, my community, my family rallied behind me. My community, my church family, prayed for me and with me. So it really has been, a journey throughout this entire process and even up into this day. I, as a family, we sought out, support groups and, you know, other people living with the condition. But at the time, so I was diagnosed in 1998. So eons ago. And so at that time, it was thought of as only people of Jewish descent or European or white people could get the disease. So that played a factor. And
ah,
when I was in these support groups, that's all I saw. When I
interesting.
connected with other people that had the disease, that's all I saw. For a very long time, I was one of the only people that looked like me in these groups. Um, that that was for a very long time, and that shaped me. I felt alone, not seeing anyone that looked like me. And then, as far as race, but also as far as age, because of the severity of my disease, the other children that I saw, other adolescents that I saw that had my disease, they, in my opinion, and what I saw on the surface, didn't have it as severely as me. So, I always felt alone, growing up with Crohn's disease. Um, yeah, it was very isolating.
I'm sorry.
Oh, no worries. Brought me to where I am today.
I hear you. So you're a model
Yeah.
with an ostomy bag. Is there like how does your modeling differ having an ostomy bag? Does it differ from what people understand modeling to be?
I don't think so, and I would hope not. Of course, my primary goal in modeling is to showcase that you can, beauty comes in all different forms and that ostomies are beautiful. The mere fact that ostomy saves lives, you know, proves that point. Anything that can save a life is beautiful. So I would hope that it's not looked at as something, you know, out of the ordinary. I mean, I guess it is out of the ordinary, but it's just a model. I'm just a model that has an ostomy bag that just so happens to have an ostomy.
Have you dealt with any misconceptions, and how do you address them if you have?
Oh yes. Um, I deal with misconceptions often within the general public, and sadly within the medical and public health community. When I was diagnosed with Crohn's, very shortly after that, my medical providers told me that that was going to be in my future. And my medical providers did everything possible, trying not to get me to have ostomy surgery. So in my mind, in our minds, my family minds, we're thinking, if they don't want me to have ostomy surgery, this must mean like it's bad, and they made it seem that or perceive that ostomy surgery would be like the end of everything. I received
Um,
comments like, yeah, like, you know, thankfully that the rhetoric is changing, but back then, providers didn't want you to have surgery. They did everything possible. Like I was on clinical trials, different medicines, yeah, all in an effort not to have an ostomy. And even to this day, when I tell providers that I have an ostomy, the first thing they say is, "Oh, I'm so sorry. I'm so sorry that happened to you." And I would like to say that it just it depends how I'm feeling on that day, how I respond.
mhm.
I like to say that I can boldly say that I correct them, but at times it is hurtful. It is still hurtful, like when I receive those comments. And when it comes from medical providers, I am stunned, that they still have that misperception. And I know that there's more work to be done. So to dispel these misconceptions and myths. So, that's why I do what I do because it's not a death sentence. And it can quite literally give you a new life. So, which it's done for me.
Well, it saved your life. I mean,
Absolutely.
I have a friend who has an ostomy bag. Um,
Hmm.
he's had it for many, many, many years, and his life is absolutely fine. I mean, yeah, there's no difference in the way he lives and the way anyone else lives.
Right.
So I don't know. Do you find that there's more acceptance with men than there is with women?
That's a good question. So I would say in the Black community, it could be the opposite. Like black males that I know that have ostomies, they don't talk about it. I mean, they share it with me, but they don't talk about it. And even those that I do know, they so for instance, there's this one guy that was in one of my support groups, and for a long time I did like he was always there, but I didn't know that he was like like about to have an ostomy, and it was like maybe a year later he's like, I have an ostomy, and that's just something. I think it's the disease itself. IBD as a whole is highly stigmatized. It's
Hmm.
is the nature of the disease can be difficult to talk about. So I feel like with both men and women, it's difficult to discuss. But I feel like in with Black people, mainly more so because it's seen as something is wrong with me, and I may not be the man that I'm supposed to be or be able to provide or something like that. So
There's a stigma. Mhm.
yeah, absolutely.
What kind of barriers do you believe Black women in particular face when dealing with IBD?
Hmm. So I feel that when discussing, so for instance, most recently, I had a horrific experience, which brought back trauma from my initial diagnosis of being understood, being listened to, and I felt that that was there were many factors that played into that. So I live with chronic pain. So that's all, that's, a barrier. I'm a Black woman. I'm a woman that lives in pain. We are perceived as, you can handle the pain or the pain's
Right.
not that bad.
Right.
And so that has always been something that, I've struggled with chronic pain since my surgeries, multiple surgeries. So that's been a journey in itself. I remember receiving a diagnosis, um, but then, that doctor left and having to go to another doctor, and that provider not believing me, even though I had the diagnosis, because of how I appeared. Um, and so I believe not being believed. Um, and sometimes I feel, and I recognize my privilege in this way that I am knowledgeable about my disease, and I do the research, and sometimes I feel that, how do I want to say this? Like intimidation is a factor as well when it comes to Black women. That for providers being intimidated, maybe that, she knows what she's talking about, then, I have to, dispute that in any way possible. I don't know, like,
Mhm. Right.
um,
So in other words, you're challenging their authority as the clinician, and so
yes,
they feel that they have to push back
right, yes,
rather than listening to you as the patient who
yes,
knows your body and knows your diagnosis.
absolutely. Thank you. Yes, absolutely. I think I've run into that often. And then back to the chronic pain and then just being believed. So I spoke of an experience most recently that I was experiencing symptoms. I, went to the provider and was like, I think it's this. You need to check this. Could you please check this? I wasn't, you need to check this, but can you please check this? I think this is going on. Had pushback for months until I found a provider that looked like me. And what I had initially went in for, that's what it was. So, it's just the not being believed, I feel like is a barrier. And that's through, their own misconceptions and beliefs or perceptions of, you know,
Well,
you know,
I'm curious. So, is it because you don't like? So, is it? Are they giving you the impression that you don't look like someone who would have an ostomy bag? I'm trying to understand, like, what the pushback is exactly.
I do too. Like I struggle with that as well. I get that often that, I don't look like, and thank God I don't look like what I've been through. But it's still it's still an issue, I feel like, because I'm not going in there bent over, woe is me, that sometimes I feel like I'm not believed.
Ah,
Like looking
because I was going to ask you, well, what does that look like? What are they
right,
expecting you to?
right. What does that look like? What does sick look like? Why do you have to look a certain way to be believed? That's something that I struggle with, and I hate in the medical system. But I feel like, dealing with chronic pain is one of the biggest barriers, and getting the help and relief that I need. I've had to advocate fiercely for that. And I'm thankfully have providers now that, believe me. And but that wasn't always the case. Like I fought for decades for the pain that I was in. Yeah, so
So were there breaks in your care because of these fights with
so
providers, with fights for yourself?
I would say breaks in my care because I felt discouraged. Um,
Oh,
like, okay, so if they're not going to believe me, what do I do? Like, so breaks in my care in that way, breaks in my care, not having the right specialist around me. Um, and, I feel like that's a barrier for Black people as well. Black people suffer with more severe IBD, more severe disease, more severe complications. And we need specialists that can handle our severe disease. And general gastroenterologists might not have the skill to deal with the complications that come with severe disease. So I think that's also a barrier that the Black population faces as well, not having access to these IBD centers, not having access to clinical trials, and yeah, not
and
have.
and and probably providers not being aware that Black people actually
Oh
get
yes.
IBDs.
Yes, yes. I remember just like distinctly, there was a conversation that I had with my provider, and this is somebody that I had been going with, that had been with for years, and we had this type of relationship that we would go back and forth. And it was early on in my disease journey where the medicines weren't working. And so I was thinking like, okay, so what else could it be? Like I was like, maybe I have celiac. Because nothing's working. It's something that I ate. And I told my provider, I was like, can we check for celiac? And his response was, well, Black people don't get celiac. And
Oh, wow.
this was back in sorry, this was back in the early 2000s. And so I said, well, Black people don't get Crohn's either, remember? And he was like, you're right. Okay, let's test. So, like, we had that type of relationship, but
Mhm.
that just speaks to the perceptions that
Right.
medical professionals are taught. So,
That is wild.
yeah,
Wow.
yeah,
Wow.
hmm that happened. And, we had that relationship that he would say it. I'm sure other providers just wouldn't say it, would just think that and dismiss. So, but that's something that I value with my providers, like having that open, trusting relationship. Or you have to find that, but that's something that I look for.
Well, circling back to the modeling a bit, how has sharing your story and modeling with an ostomy empowered you personally? And how do you hope it will impact others?
It has profoundly impacted me. Um, I think in a sense of gratitude and pride. Pride because I am very proud of, you know, that work, um, and thankful for it. And proud that I didn't let my disease or my condition stop me from pursuing that, or pursuing avenues like that, or even thinking that I could do something like that, like so yeah, it's just something that I'm very proud of, and I hope that it shows others that are in similar situations that you can do anything that you put your mind to. And I hope that and I do feel that it's beginning to, or it's breaking down the stigma of living with an ostomy in the general public, um, and changes how we see and accept beauty as a whole. It's not the cookie cutter that we're used to. Um, yeah, I think I'm proud of the work, you know, if I can say that. But because I desperately needed that when I was younger. Like if
Right.
I had seen that, then I wouldn't have been so scared. to have this surgery, I wouldn't have waited for so long. I wouldn't have suffered for so long. Um, like I suffered unnecessarily, really, because I was afraid of ostomy surgery. And so, yeah, I just hope that it provides that for somebody else, because it's needed. It's still needed. So,
And so how does it work? Do you so when you show up for the shoot, is it part of like let's say it's a bikini shoot and you would like do they know this going in or is it like, oh, and by the way, I have an ostomy?
so they knew this going in. So right, I worked with primarily American Eagle area. And so they knew this going in with my audition or so they had an open call and I submitted a video like sharing my story. Um, and I've done this lots of times, like to different companies, and I never get a call back. I just do it. But I received a call back, and so I was just like, oh my goodness, like I couldn't believe it. So they knew that what knew that I had one, and that's where the sense of gratitude comes in because just thankful for an organization, like that to support and understand how impactful that could be to patients like me. So they knew and they were amazing with it. I didn't feel any type of way. I was walking around with the other models, in my underwear, ostomy bag showing, like it wasn't like taboo or anything.
Right.
Uh,
Mhm.
yeah, it was great.
That's fantastic.
Yeah.
What advice do you have for other young patients who are coming to terms with the reality of living with Crohn's or ulcerative colitis?
Hmm. To It's a journey. Um, it's a journey. So I was diagnosed in 1998. That was 20 something years ago. And I, to this day, am still learning to cope, learning to accept my limitations, but also learning that my limitations don't have to limit what I do. It might just change how I do it. Um, so yeah, just take your time. Every IBD patient is different. Um, and just really discover your own journey. And then I would also add to build a community, build, seek out a community, um, because you have to know what you're going through, you'll get through. And I have found that within the IBD social circle. I have been with the IBD social circle since the beginning of my advocacy. And within that community, I'm just so thankful for it. Um, it's a community of patients, providers, and it's just really a collaborative effort to bring awareness to the disease, to come together to support one another, to educate other patients and empower other patients, and to really, yeah, I'm thankful. Building a community of people that are going through similar situations is key in navigating chronic illness as a whole. Like I could not do this without my community.
Did these communities exist when you were 14? Like what would you say this to your 14-year-old self?
I would say this to my 14-year-old self, but it would not have been there. Like I would say that. I would say seek out in a way
Hmm.
like at that age, how do you do that? Like so we did, like we sought out found the foundation, different groups, but at that time nobody looked like me. So it was difficult, but
Right.
we did that. It just wasn't what it is now. Um,
Mm.
so, I'm thankful for what it is now. Thankful for the IBD social circle and, other groups that have provided that sense of community that make you feel less alone. And um, yeah, just because living with Crohn's disease, living with an ostomy is incredibly isolating due to the nature of the disease, due to the symptoms of the disease. So, community is paramount, I feel, in navigating the difficulties that IBD can bring.
In your experience, how can healthcare providers build better communication and trust with Black IBD
Hmm. So I think I kind of mentioned this, like, so I have sought out, providers that bring that sense of trust for me. And I feel that providers can seek out different groups like the IBD Social Circle, that we are bringing resources to the community, educational resources, culturally competent resources. Um, and I feel that something that providers could have to remain is culturally or have cultural humility, and that is being able to know that they don't know it all and know that um, the landscape um, of the IBD population is ever changing. It cultures change, diets change, like how we see and how we live through our lived experiences within each population or within the Black population, um, profoundly impact how we experience the disease. So, providers being culturally humble, or having humility, and as a result, being culturally competent and providing care that, reflects how we live our lives, I think that's key. And then really listening and building that relationship, building the trust, which takes time. Um,
Well, how do you find the right provider that speaks to you the way you need to be spoken to?
and I feel like this is something that you have to be empowered to do. And I say that because I'm working with this with my parents, with their medical providers, like being able to ask questions. And I feel like, that comes from historical injustices, how Black people may feel toward the medical providers, medical communities. But you have to be able to ask questions and the provider not be offended, not be um, feel some type of way. And if they do, then feel comfortable in going somewhere else. So it's not like a one stop shop. Like I have sought out that type of provider. Like I come with a list of questions. Um, they don't say the right thing. I'll find somebody else. Like it's a process. Like, and it can be daunting and exhausting. But I think that comes with being empowered and being your own advocate and having, you know, knowing what you need and having, I guess, the disease journey that, I've had, like knowing that I need this type of care to live the life that I would like to live, I guess.
Hmm.
So it's a process and it's not easy. Like I said before, it can be hurtful. Providers can say things that can hurt your feelings, but you just have to stand in what you believe in. Like, ask the tough questions. Like I said, I'm working with this with my parents.
Hmm. This
So,
a lot of this sounds like the combination of like insurance and availability. Because
mhm,
let's say you have let's say you live in a rural area where your treatment options are limited, you know,
okay.
in terms of, GI specialists who are knowledgeable about inflammatory bowel diseases. Um, it might be difficult to find, that right provider. Um, so that just, that I'm just like kind of saying that out loud that, it sounds to me like in that case, the patient needs to be their be their own advocate and
Right.
speak up because if they don't and they don't have those options to walk away and find another provider, they may be stuck with that they may be stuck with that provider, and then what?
Yeah, and I'm glad you said that because I do recognize my own privilege in being, having, excellent health insurance, and being able to do that. And so that goes to seeking out communities of patients like yourself and being abreast of, the research that's out there. Because these like patient communities, have knowledge of different new and upcoming, treatment options. So just like you said, being an advocate for yourself, if you don't have those options, knowing the research yourself, um, know, like I've always said, an educated patient is an empowered patient. So educating yourself, um, as much as you can, um, and people, I have family that lives in rural areas. I have an aunt that, I work in public health, so it's always interesting to recognize these limitations and what you talk about in your own family. So, like my aunt, she lives in rural, down South Georgia, um, doesn't, um, is not familiar with the internet, and is, somebody that can't readily seek out these types of things, right? So,
Right.
I work with her, we work with her. So, and just like reaching out and being open about what you're going through. And I think that that's something within the Black community we don't talk about. We don't talk about disease. So, being open and sharing what you're going through because you don't know who can help, who else is going through similar situations that can help your situation. So just being open and sharing and that's also advocating for yourself.
Hmm. Yeah, that's true. Speaking of community, what changes would you like to see in the IBD community to reduce disparity and address stigma?
Hmm. I think more collaboration within the different communities, different organizations. Um,
So you mean like the different organizations all working together?
yeah. So, like the IBD Social Circle, we are an inclusive community with providers, patients, and, more of that, more of bringing patients and providers together, working across the table, um, listening to each other, being open to our lived experiences or highlighting the differences that we may share. I think when you talk more and share more, you'll understand how the historical injustices and systems that have been put in place impact more than one population. Yeah, I think we just got to reach across the aisle. We have to talk to each other. We have to collaborate. We just have to work together. And that takes time, that takes resources, but I think it's something that can be done
Mhm.
in our lifetime.
It also sounds like more providers need to be, their awareness
Mhm.
needs to be increased as well. So like the providers that are part of the social circle, they're already that's the choir you're preaching to. But
Yes,
your experience of a lot of people, those providers were not part of the IBD social circle. And so I think it sounds to me like experiences would be better if more providers were aware culturally and also diagnostically, so that
yes.
you don't have a provider saying, "Oh, that's ridiculous. Black people don't get that disease." That's still so wild to me.
Oh, yeah, that happened. Yeah.
I still can't believe that happened. That's incredible.
It really is. But like if you would if so my sister would always say, I've never seen a patient doctor relationship like y'all. Like we would go back and forth. Like that was just our relationship. And so it but I don't think it was something that I didn't take it personally at that time.
Mhm.
Like because I just came back with, well, black people don't get Crohn's, and he was like, you're right. So it was just, our back and forth, but that's a reality. So, and other doctors think that and might not, push forward. So that happens. So yeah, so how do we spread the awareness to providers such as that don't are not involved in these communities? Like spreading more education, getting it out there, spreading more awareness. Yeah.
Well, I'm looking forward to increased awareness among providers and stronger advocacy among patients.
Hmm.
That sounds like the sweet spot
Yeah.
for spreading the word and making more people aware.
Hmm.
Ellen, I want to thank you for your time today. Thank you for your advocacy work, and thank you for sharing your journey with me today. I really appreciate it.
Thank you so much. Thank you for having me. I appreciate it.